Welcome everyone. Slightly late start, apologies for that. Like Councillor Gosling, who I'll give apologies for in a minute. A few work commitments this morning, so just overran a little bit. I'm Councillor Matthew Winnington, Campbell for Health, Wellbeing and Social Care. If the continuous fire alarm sounds, please evacuate the room and public gallery. No one in the public gallery today. By the stairwells. Do not attempt to use the lifts. Please assemble in the turning circle at the end of King Henry Street past the University Park building. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. There's no members of the press and public, so I'll skip that bit. Please can everyone use the microphones and remember to switch them off when they are finished. So, introductions. Anna.
Anna Martin, Democratic Services.
Myself. Yinka Adeniran, Councillor for Charles Dickens Ward, Labour Opposition Spokesperson for Health, Wellbeing and Social Care. Thank you.
Brian Madgwick, thank you, Chair. Brian Madgwick, Independent Councillor for Portsmouth, Opposition Spokesman.
Louise O'Sullivan, Group Accountant supporting adult social care and public health.
Good morning, Andy Biddle, Director of Adult Social Care, Portsmouth City Council.
Good morning, it's Bernie Allen. I'm here on behalf of Joe York from Health and Care Portsmouth, Hampshire, Southampton and Isle of Wight ICB.
Rory Massey, COO for Age UK Portsmouth.
Thanks very much, everyone. So there are no deputation requests, so that's fine. Apologies for absence. So we have Councillor Lewis Gosling, who has given last-minute apologies because of work commitments, and Joe York, Health and Care Portsmouth. So we have Bernie here, who is in her place. Members, any declarations of interest? No? Fantastic. Okay, so without further ado, we move on to agenda item 3, meals delivery service. Over to you, Andy.
Thank you, Chair, and I'm delighted that Rory's here with us from Age UK Portsmouth. So I'll read through the report, and Rory may be able to add some bits and pieces as he was responsible for running the service. So first couple of sections of the report detail why we're here. This report was requested in July of this year, following a report that we brought to this meeting in that month as an update to the arrangements that we put in place when the meals delivery contract ceased in March of this year, the previous contract. In section 3, that lays out the temporary arrangements that were in place from April to June of this year, and the options that we used to ensure that Portsmouth residents had access to a meal while we were putting in place more permanent arrangements. For section 4, this section details the transition to Age UK Portsmouth as the new provider of the service, and the graduated process by which Age UK Portsmouth took on Portsmouth residents to the new service, and then the number of residents and meals being provided as of October of this year. Section 5, probably the most important section in the report, because it demonstrates the additional value of the service being administered by a local provider who also provides other support to Portsmouth residents as part of a local charity. The example given in section 5 demonstrates how the meals service led to 4 other elements of support being made available to our resident, and demonstrates clearly the outcome that the council wanted to achieve by having a local organisation delivering less meals per hour so that they could use that time to add value to our residents. Finally, in section 6, section 6 says the challenges of making the scheme work for a charity that has a limited budget. Despite these challenges, the council is committed to try and address the issues and continue to grow the service, given the obvious benefits for our residents. That's the report before you. Happy to take any questions or indeed for Rory to add anything to it.
Thank you very much. As Rory said, Rory, do you want to say anything at this time?
Yeah, so really just wanted to briefly touch on the service and how it's operating at the moment. From an operational standpoint, it's going really well. It's being met very positively by residents of Portsmouth. Food is a subjective thing, so there's obviously some people who aren't terribly keen on some of the menu choices, but the quality of food is being quite highly regarded in some of the feedback. Just wanted to touch on a couple of successes. So the relationship we've been able to build with the Independence and Wellbeing team off the back of the contract is really healthy. Sharon Furtado and her team are an incredible team and have worked incredibly hard alongside us to make the service viable and a sought after service. We are looking to increase the or improve the interaction between service user and driver. The main focus was to improve the welfare checks and ensuring people's well-being is looked after. We're looking to train all of the drivers in Make Every Contact Count and make sure that they're noticing triggers in people so that they can highlight it to the coordinator back at the office. The feedback is really positive. I'm sure it's in the report, and we provided a case study, and that's just one of a few already that we've been able to support people with in more in detail, more in depth issues. Obviously, there are some challenges. They are largely centred around the financial picture. The charity have absorbed losses since its inception, and obviously for a local independent charity, losses are less than ideal. We are trending in the right direction. We can see light at the end of the tunnel. We know exactly how many meals we need to provide. We know our cafe needs to open to subsidise the Meals on Wheels service, so we know exactly what we need to do. We've just obviously, in the implementation and the swift implementation of the service, had to absorb approximately to date £29,000 worth of loss into the charity. That being said, City Council have been quite good and allowed us to purchase some equipment to increase capacity. We're still waiting to receive payment for those items, one of which was made in August. But generally, the relationship is really good, and it's a very positive place, barring the financial standing. But as it pertains to the service user, they feel incredibly looked after, I believe. We're now delivering 70 meals a day, approximately, and we're just looking for that golden goose of 93 meals a day, and then the service will be where it needs to be.
Thanks very much, Andy and Rory. Colleagues, any comments, questions? Brian?
It's not a direct one, and I will get more information and bring back to here and maybe full council. But it's worth making a note of that a church in Portsgrove provide food in the way of fresh fruit, vegetables, salads, etc. They grow them there, and people are free to come and help themselves. And I should note that when you think of Portsgrove, nobody's coming with big bags and taking 20 cucumbers to sell them or whatever it may be. And I think it's something that may help both of you in this foods. That if we get the other councillors, etc., involved, then that should help the food problems and the feeding of people, whether they are in homes, or whether they're in their own houses or flats, or whether they're on the street. They can go to that church and they can get food. So I think it's something that we'll bring up later on, maybe here, when I've got a full identity of everything involved in it, and bring it up maybe at full council so we can all get involved in it and help those in need. Thank you, Chair.
Thanks, Brian. I think that's something just in general, in terms of obviously for people who are without food and struggling to make ends meet. This is a little bit different in terms of this is about planned meals on wheels every day. People who people are paying for it, so it's paid service, and obviously this is hot meals in the homes with the welfare checks as well.
Yeah, all I'm saying, I appreciate that, fully understand that, but what I'm saying is that, okay, they might get a meal a day or something, but there's other food available for them if they want them, whether it be apples or whatever. Everybody is short, whether they're in, as I say, on the streets or wherever. It's just something I think people should know about. Thank you, Chair.
Thanks, Brian. Yinka, did you...
There's nothing really from me, but all I can say is thank you, because the last time we had discussion on the meal food, I remember they were saying something about serving cold food or something, but now I think there's a lot of improvement. So well done. Thank you.
Thanks, Yinka. I think, well, from the beginning of this service, I know it's been hot food, as Andy and I had a hand in making a few of them, which was a good experience. And but as I always put in Andy to work. But I'd just like to thank the report and for the updates. I know we committed to doing an update on a regular basis. I think it'd be good again to have one in maybe 6 months' time. So we go for about a year at that point, which would be really, really sensible to do. I think I was talking to Rory last week at the AGK Open Day, and I think it is really good, this new service, what it's reaching and what it's doing. And I know obviously there are plans to make sure we get to that 93 meals a day and beyond, because I think there's the real opportunity here to provide, as was mentioned, not just about the meals itself, but also about the welfare checks and the checking in with people. And I think that's the most important thing. This is a value-added service. It's not just this, and it's working with a local charity like AGK Portsmouth, which is a real positive for us, because it just gives that welfare check side, but also obviously an in on all their other services that they have, that they can then tap into, and of course their relationships with other organisations, both in the voluntary and statutory sector as well, across the city. So thanks so much for the reports. Thank you to everyone at AGK Portsmouth for their work on their Meals on Wheels, and long may it continue. And obviously any support we can give you is there and for you, and I'll look forward to it being a great success on top of what it already is. So very happy to note that report. And just before we go on to item 3, I see Claire has come in. So Claire, would you like to introduce yourself? Claire, don't hold it down.
Oh, sorry. Claire Ratchwell, Deputy Head of Service in Adult Social Care.
Thank you, Claire. Yeah, it happened at Health and Wellbeing Board last week. People were not being able to be heard, and they was wondering why. It's because they're holding the button down. Very old school. So the next one we have is on co-production. So over to you, Claire, or Andy, or whoever's going to start.
Do you mind starting, Andy? I'll just find the paper.
That's fine. My lack of preparation, Chair, I was on leave last week, so I haven't had a chance for a conversation with Claire. So the paper before you is the title of co-production. So sections 1, 2 and 3.1 set out how the report intends to demonstrate the approach that adult social care take to involving Portsmouth residents in developing and delivering services, and how the adult social care strategy intends to enable that approach. Yep. I'll hand over to Claire.
Thank you. Sorry I couldn't join for the beginning of the meeting. So the report sets out how we really want to make a fairly significant change in the way we work in adult social care, moving our culture from one where we sort of default to things like surveys and kind of very kind of small, distinct groups of people to inform us on particular matters, to taking co-production and engagement as kind of core everyday business. So there are some specific examples in the report that we want to start with. But just to give a bit of background to it, the Care Act obviously is a core piece of legislation for us in social care, and it talks about local authorities actively promoting participation specifically in providing intervention, so specifically in the work we do with individuals and communities. The CQC inspection framework, the new framework, talks about person-centred approaches, which is about sort of co-producing and co-working with that individual, but also at a sort of community level as well. In our strategy, we quote from that is, we will aim to start from a position of assuming full co-production. So this is really quite significant change from sort of asking and informing at a more general level. There are a couple of other policy documents which I've detailed in there. We're going to be using something called the Ladder of Engagement or Co-Production, which has been produced by Think Local Act Personal, and it's a really useful tool actually. At the bottom of the ladder you have coercion, so forcing people to join in with whatever you're doing, obviously not something we aspire to, and it goes up through all the different levels: educating, informing, consulting, engaging, and then right to the top, co-designing, where you do everything alongside the community or the individual, and co-production, where communities and individuals are actually involved in the work that you're doing in delivering and providing services. Excuse me. So just to give one example, the Portsmouth Autism Community Forum is a community-based group that we in social care help to organise and facilitate. It's chaired by an independent chair who's a parent of an autistic person. That person's also a GP, so she's got lots of experience working with autistic people herself. And the group is a really strong, proactive group made up of lots of autistic and neurodivergent people, as well as professionals. And many of those professionals are also autistic or neurodivergent themselves. And it's leading work, coordinating work, which is all co-produced. So we're not doing anything through the Autism Forum which isn't co-designed and co-produced with autistic and neurodivergent people. And I have to say those services are significantly stronger and kind of better received by the autistic community because of that. So that's just one example. There are other examples within social care in the integrated learning disability team where they have it as standard, for example, that people with learning disabilities who use their services are involved in developing, designing services and things like recruitment. And recruitment is one of the things that we really want to focus on this year to ensure that all recruitment that happens in adult social care has the involvement from the very beginning of designing a job profile all the way through to interviewing and appointing of people who basically have an interest in this, in our services, whether they've used them, whether they've supported people who have used services or are part of the wider community. Other priorities for us really include a bit of workforce development, so understanding where we're at in our workforce, how much people are involving and including people in the design and delivery of services now, where there are gaps, where people need to understand more about how we can do that better. And also things like payment for involvement. So the ICB, the Integrated Care Board, have come up with a payment for involvement policy, and we're just working through how we can use that in adult social care to really recognise the valuable contribution that people are making to the design and delivery of services. We're also going to link this into our quality agenda. So obviously, if you design and deliver services with people who really know what's needed and know how things work, you're likely to get a much higher quality service. Commissioning and contracts, so that links into how we design our commission services, excuse me. And we want to link into achieving culture change across the health and social care system too, so thinking about us as just part of that system and how we can influence wider and link into what's happening in the wider system. So I think that's it for the time being. There will be quite a bit of activity ongoing. We're kind of at the beginning of it now, consolidating what we've got and planning how to move forward.
Thank you very much, Claire. Any comments or questions, members? No? Okay, so I'd just like to say a few bits and pieces. So thank you so much, Claire, for the reports, and to all the team within Health and Care Portsmouth who are working towards it as well. So because this includes not just the City Council, but beyond as well, and of course all our partners who are involved as well. I was at the Carers Count event with Claire a couple of weeks ago now, and that at the heart of that was co-production. There was a lot of work going on there, especially around, in that case, obviously carers, but obviously other than what Claire has already mentioned, one of the massive things that's going on with co-production at the moment is the mental health transformation, which has been ongoing for some time now, and at the very heart of that is the working with the Hive to engage with service users for mental health services, and in the case of dementia, their carers as well, in particular, to really sort of move forwards with that co-production. And it's also, I think, we're going back to the Meals on Wheels service, that kind of thing in terms of the input from people on their experiences and everything, that obviously with any organisation that's running a service like that, that's really valuable to get that feedback, and then it helps you develop it as well. And certainly I know from my day job that when you involve your service users, and in our case our carers as well, then it really makes a difference to what you can provide. Think Local Act Personal is a national charity which was actually at a conference I was at a few weeks ago, and there was a lot about co-production at the National Adults and Children's Services Conference. So not only do I think this is really important, but it's also very timely as well, because this is something that is growing more and more within how you do things more generally, because an understanding that this is absolutely critical to how we do things going forwards. So thank you so much for that. Obviously we've got the next report as well, which sort of links in very nicely with Claire's example that she gave in the report about people with neurodiversity, and that really is obviously a big thing we're doing at the moment. But this is also something that again we look at across the council. So I think we have the most areas where we do co-production in the health, wellbeing and social care portfolio. However, this does also, you could use similar things and engage them with lots of different places in the council as well. Not least children's, but also other places as well, when we have engagement events and doing things. So it's a timely report, it's a very good report, and very happy to note it, and look forward to more co-production, and that to become completely embedded within our council. Okay, so without further ado then, on to item 5, working with autism and neurodivergence, including transition.
Okay, so I'll give a brief summary of the report. We are very fortunate to have Claire with us. She's done a considerable amount of work in this area, as you picked up from the last report, so can probably bring some of these things to life better than I will, but I'll do a brief summary of the report. So the purpose of the report is to update Cabinet Member and spokespeople of the work to support autistic and neurodivergent people in Portsmouth. Section 3 sets out the national policy intention of support for people, the local arrangements we have in place through our forum and its purpose that Claire was just touching on, and the action plan that was in place until this year. Sections 4.1, 4.2 and 4.3 set out the report, and it's also been included in an appendix for your information. And this was prepared based on the experience of autistic neurodivergent residents in Portsmouth, a prime example of co-production, and the findings that came from it that led the Community Forum to develop the principles for how services and organisations should operate with people who identify as autistic or neurodivergent. In section 4.4, we've set out the recommendations for how service should operate in health and care organisations and in adult social care specifically, which will be guiding how we work. And then in section 5, there's some of the actions in process or in place to support Portsmouth residents that we're taking forward. Did you want to come in on that, Claire?
Yeah, shall I talk a bit about what we're sort of actually doing now, some new stuff. So as Andy mentioned, I was very fortunate to be able to take some time out of the day job last year and do this piece of sort of local research, really, talking to 90 people in the city, that's autistic and neurodivergent people, friends and family members and professionals. And as Andy mentioned, there are the full kind of overview of the recommendations are there, and this new work that we've started now kind of picks up from those recommendations. So the first recommendation was around transition from children's services to adult services. People said things to me like, I feel like we're being pushed off a cliff in that transition from children's to adult services. It's something that we already knew was a gap, and the senior management team from Adult Social Care had already committed to employing a transition lead. That's Lisa Granger, who actually produced the report. And the next sort of set of recommendations really were around support directly to autistic and neurodivergent people and building better knowledge in the community and in the workforce. So starting with that second area, Room 1 is our new community-based hub for autistic and neurodivergent people. We are starting reasonably small. We're one room at the Charles Dickens Community Centre. It's facilitated by one full-time member of staff, but doing a job share. So it's 2 people. And both of those people, they won't mind me sharing, they're both autistic and neurodivergent themselves, so they have, and they're incredibly knowledgeable and capable people who have that real insight both personally but also a huge amount of professional knowledge and experience. So Room 1 at the moment, excuse me, is providing information and advice, guidance, onward referral to more in-depth services, peer and group support, and we're already outgrowing the room. We only started opening to groups at the beginning of September, so we're currently looking for a bigger venue already. So that's really good, really successful. We're also capturing what people are asking for, so we've got a better understanding of need, really strong themes coming through around advocacy, support in the workplace, and there's a new commissioned service just starting Thursday, I think it started, through the U Trust for more employment support for autistic and neurodivergent people. So things are really coming together quite quickly actually around that support offer. I'll just focus on transition now as well. There are some other bits and pieces in there, and I'm happy to take questions. So that transition from children's services into adult services is obviously a really key point, and we're very, very keen to ensure we get it as right as we possibly can at that crucial phase when young people are transitioning into adulthood. So our transition lead, Lisa, is working really closely with Children's Services to make sure that people are identified as early on as possible. Autistic and neurodivergent people coming through from Children's Services, whether they're in education or not. And we've recently appointed a very small specialist team, one social worker part-time, one occupational therapist who's full-time, and an independent support assistant, that's sort of equivalent to an unqualified social worker type role, and she's 30 hours a week. So those dedicated staff will be specifically supporting young people as they come through from Children's Services and looking at what type of support might be needed into adulthood, and what kind of skills and aspirations people want to get. You know, this is not just about social care support, this is about what people want life to look like as they move forward into adulthood. So, as I say, that's very new as well. Staff started at the end of September and beginning of October. So we potentially could come back with a further update in the future. And just quickly on workforce development, there was a small amount of money allocated from the ICB to develop some training videos. So those have been in the process of being co-produced with autistic and neurodivergent people, and hopefully we'll have a nice kind of fairly brief video kind of content training offer that can go out to anyone who wants to see it, really. Hopefully we'll have that quite soon in the next couple of months. And that's just the beginning, really, of developing a new training offer. Also in line with the rollout of the Oliver McGowan mandatory training, which will be a requirement for anyone in health and social care who's likely to come into contact with an autistic or neurodivergent person or someone with learning disabilities. So we're just in the process of working out how to roll that out too. I think that was released about 2 weeks ago. Finally, we will be developing a new strategic plan for the city, likely to be an adults plan at this point in time, as Children's Services have their own plan, but we are working closely with Children's Services to make sure that everything we do is aligned, everything we do is as collaborative as possible, and most importantly, everything we do kind of fits together from the point of view of people who are needing to access support from us. I think that's it.
Thank you, Claire. Any comments or questions, members? Yinka.
Thank you, Claire. Just wanted to ask, the one in Charles Dickens Activity Centre, is it started already, or you are proposing that one?
Yeah, it has started already. Following all the usual IT setup and risk assessments, we actually started opening our doors to people at the beginning of September. It is very small, so it's part-time at the moment, so delivering a kind of limited number of groups and drop-in sessions. But we're hoping to grow that as sort of time goes on, and there's potentially looking at some new money coming through from NHS England, which hopefully will allow us to expand a little bit, because it's quite limited at the moment.
Okay, so which day of the week do they run it?
So currently, off the top of my head, there are drop-ins. So they started off with quite a lot of groups and drop-ins, and they're finding that actually it might make more sense to consolidate some of those. We're just about to review what we're doing and when. Currently there's a group that happens on Mondays. It's likely to merge with the Tuesday group. So Tuesday afternoons and Thursdays are the main kind of times at the moment. There are also slots for people to book in one-to-one, and there's been quite a lot of professionals training going on as well. So we're just kind of struggling to fit everything in. You know, we're keen to kind of do as much as possible, but at the same time, when something's new, it can be quite overwhelming. So we're just kind of working through that at the moment.
Okay, thank you. So are we allowed to pop in and see what they are doing there?
Potentially, the best thing to do is to organise it so that, because it's only one room, so if they're having a one-to-one with someone, then obviously that would be kind of like a confidential conversation. So, but happy to organise something.
Okay, thank you.
Thanks very much. Did you want anything, Brian? No, that's fine. Thank you so much for the report, Andy and Claire. I know this has been, as you mentioned, a lot of work that's you've been doing on this and with the team, and of course, this is something that we're in need of doing because the strategy has expired. So moving forward to a new plan going forwards, I'm particularly excited about the Room 1. Which I think is fantastic, and it's the fact that it's already getting a bit need a bigger space, which I think is just a testament to how much it was needed in the first place. So it's fantastic to see that is up and running. I think I just want to mention about the transition. Transition is such a massive issue within social care within the city, and to have this as a specific thing for people who are neurodivergent, then it's really important because they have a lot of additional support needs that other people do not face, and so that is really, really positive. And as Claire said, I think not to underestimate the co-working we're doing with, let's say co-production we're doing with children's on this, because it's absolutely critical that we have that input from not just children's services but also young people as well. So people who are children who are neurodivergent, in terms of what challenges they are looking at facing, and then obviously people who have been through that, what challenges they face, because as we know, if we get transition rights across the board, then that's really going to be beneficial, not just to the people with the care and support needs, but also for the system as well, because it means that we can support them right through. I'd just like to draw a thing which I think comes in with Yinka's point really. At the very end of the report, it says, Adult Social Care and the Portsmouth Autism Community Forum would welcome further involvement from elected members, and would be happy to share more details on the finding from the report at a future meeting or event. So I think that would be really sensible to put that out. I know we had, obviously the report came to the Health and Wellbeing Board, but I think that might be something that we can organise for members more widely who are interested to have maybe a Teams meeting or something to go over it and get that, and also it'd be really good to have people from the Autism Community Forum there, and then people can have those conversations directly. So I'm very happy to know that report. Thanks so much for all the work that's going on. It's a really important bit of work, and it is one of those communities we know that traditionally has been not as well supported as it could have been, and we know that there are more and more people who are now having diagnosis to be neurodivergent compared to before. That, not to say there are more people who are neurodivergent than before, but now there is the diagnosis and there's much more understanding about it. So to get this right is a really important part of what we're doing in the city. Okay, so on to item 6, use of the Victory Unit. Andy.
Thank you, Chair. And my thanks to Claire for coming along. It gives you a break from hearing the sound of my voice on all these papers and the voice of expertise, so thank you very much. So this is the use of the Victory Unit. The report in front of you in the first 3 sections highlight the purpose of the report as an update in the planning for the use of the Victory Unit in the city. Under section 4, there's quite a long section that outlines the context and the history of the unit and how it came to be vacant during the main waves of the pandemic, when we were focusing very much on enabling swift hospital discharge for those Portsmouth residents that needed to come out of hospital and receive support post-hospital stay. Section 5 sets out the increased use of extra care as part of our strategy being developed for accommodation and support by adult social care in Portsmouth. And toward the end of Section 5, it sets out the offer from one of our current extra care housing providers who run Maritime House, the adjacent building, to develop the vacant Victory unit into extra care accommodation at no cost to the council. I think the important thing to draw out really about that is that we are keen that we continue to use whatever accommodation we have for the benefit of residents with care and support needs. And this arrangement with Housing Care 21 means we can do that with this accommodation, but we don't see the cost of the council increase. It's also helpful that we're talking about having nomination rights to this accommodation when it's refurbished, which means we can identify the people in most need and keep using extra care as part of our strategy to gradually move away from more institutional care. There are some people who always need some kind of residential nursing care environment, but in the main where we can, we try and provide a homely environment, a normal homely environment, and extra care is part of that strategy. So that's the report. As always, happy to take any questions.
Thank you, Andy. Any comments or questions, colleagues? No? I'd just like to address a slightly alarming, well, it was headline-grabbing news article on this, which I think was slightly misleading. That, yes, this was a unit that was set up for reablement, which is not the same as being a care home. So that was wrong to start with. Reablement obviously is really important for people coming from hospital and being able to get back into the community and ideally into their own homes. What this is moving to extra care, which we've discussed before at this forum and across the council, is a really important part of our strategy for enabling people to live independent lives long term in something that is their own home, but has the additional support on site for when they need it. So it is entirely misleading to say that this was a care home. It wasn't. It never was. It was about reablement. It was about moving people through to transition to their own homes. That was moved to Harry Sopnick House with our discharge to assess units, which is obviously connected, which was connected to COVID when that came through. And that then enabled us to have, and that has obviously grown and is now, as we've had the previous report, is now managed by the NHS and we co-fund it with them. But using the Victory unit now with Maritime House, with Housing 21, to have extra care facilities for the people that need it is going to be much, much better in terms of the use of our facilities, rather than leaving this empty or having a traditional care home situation. Because if we can enable people to have independent lives with the care and support they need around them, then that is going to be a much better place to be. So I completely welcome the reports, and I would hope that this is properly reported, that this is actually a very positive move. This is making the best use of this facility and this site, and that we are, and that is going to make a positive difference to people's lives, rather than, as is in the past, where you used to say the only option is going into a residential care home, even when it's not the appropriate accommodation for someone, because that's all we've got. When I came in 2018, one of the strategies I asked to do with this, in my first stint as cabinet member, was what is it we need in this city? What is the need in terms of our accommodation? That was extra care. Extra care is absolutely critical for this city. So us making the best use of our estate to do that, is completely the right thing to do, and I entirely welcome this report, and I look forward to more extra care coming online in the city in the next few years. This is the estate we've got as a council, so using it as extra care is absolutely the right thing to do, and also fits in with the One Estate project, which is the council and other bodies in the city have accommodation. What is the best use of it? And the best use of this is extra care. So I completely support the report. Thank you so much, Andy, for bringing it here. Thank you so much for the work that's going on to get this extra care moving forwards, and also to Housing 21 for offering to take that on. They might be running it. We have the nomination rights, and then that enables us to provide the best things for our people in the city. So thank you so much for the report, and I'm completely happy to note it, and look forward to to more information about how things are moving forwards in the future. Finally then, speaking about discharge to assess, Portsmouth Health and Care discharge to assess model, over to you again, Andy.
Thank you, Chair. So the paper is by way of an update, but also to talk about some of the preparations for winter. We've heard a lot in the press of late around the difficulties that will be faced by the NHS and by local government in the coming winter. We've heard partly today around food provision, which is one of those key issues for people, but we're also focused on the use of our hospitals, the use of our healthcare facilities, and being able to provide adequate social care. So the first two sections of the report set out the purpose of the paper, to update Cabinet Member and spokespeople around intermediate care, discharge to assess, and the role that Portsmouth has in supporting local NHS services. In section 3, this section describes the approach taken to enable discharge of Portsmouth residents when they no longer need acute care in hospital, and moving the activity of assessment of need outside the acute hospital. Throughout the pandemic and continuing into the future, within Portsmouth we have a multidisciplinary integrated approach to discharge, which means that we work in teams with our NHS colleagues working together with the view of the needs of Portsmouth residents being primary. What we try and do, as always working in an integrated way, is avoid bouncing people around the system, referring people to other places, but trying to meet both health and care needs in a single place, which we believe is what our residents want us to do. There's also some detail in the paper around some of the financial pressure on the council of a discharge to assess approach. It's fair to say that pre-COVID we didn't have an entirely D2A approach in Portsmouth, or indeed most other places in the country, because it brings forward people from NHS care into local authority care. So there's always some mitigation and management to do with those financial pressures. So the paper's got some detail around that and how we hope to mitigate some of those pressures through increasing the number of our residents who can benefit from discharge to assess. In effect, and Chair referred earlier to our D2A unit in Harry Sotneck that's run for us by Solent NHS Trust in partnership. If we can reduce the amount of time that people spend in that unit, we can see more of our residents go through that unit and benefit from those services that are in place. And so therefore we can take people out of hospital quicker. It's that virtuous circle approach that we're aiming for. There's a number of graphs in the paper to show the varied numbers of our residents who leave hospital under the discharge to assess process, and it's also described in the paper in section 3 around the winter planning in process as part of health and care arrangements in Portsmouth. That includes increased social work capacity for assessment and care planning, and a potential increase in capacity for beds. I've got an update at the end of this paper around those beds. It's always a complicated area to plan increased provision in beds. It's far simpler to set up increased provision in domiciliary care. So there's that balance between the two, depending on the need at the time. After this report was drafted, we were notified that a winter discharge fund would be distributed to support discharge from hospital, and we're involved in discussions with our ICB colleagues, Hampshire and Isle of Wight, as it's at the moment. The hospital discharge fund, I think formal title is Adult Social Care Hospital Discharge Fund, was announced in September of this year by the previous Health and Care Secretary, but we didn't get any detailed information on its distribution or the conditions of it until the week before last. We're obliged to put in a plan to the Department of Health and Social Care on the 16th of this month, and so it's a very live discussion at the moment as to how we manage that money for the best interests of our residents through our Health and Wellbeing Board. Finally, as an update since this paper was drafted as well, you'll note in there that we talked about the potential for the second floor of Shearwater in terms of a potential 16 beds for people leaving hospital. But since the drafting of the paper, we've actually partially opened the second floor of Shearwater and brought that into use, following the need to move residents out of a care home in the city. So we've used that accommodation temporarily, currently, to do that, to make sure that people can be safe and well and receive the care that they need. So we're currently not going to open that for hospital discharge because we will need to use it in the interim. But that hasn't taken it completely off the table. It just means that we need to use it as a priority at the moment for people that are coming out of a care home in the city. We'll evaluate the use of that facility over the winter months and try and come to the best conclusion as to how we use that for our residents, whether that be some increased provision for people discharged from hospital or whether it be where other care homes can't provide, ensuring that people have got the right accommodation and providing the care that they need. So that's the report, a couple of updates. Happy to take any questions.
Thanks, Andy. Bernie, did you want to have any comment on this at all?
No, Andy said it all.
Thank you. Colleagues, any comments or questions? Okay. Thanks for this update, Andy. I think it's a really, again, it's a really important thing. I mean, it shows how this has progressed since effectively the model was come up with initially during the pandemic, and how it's obviously moved on since then. And I think it's really clear to see it's a really key part of our health and social care. What's the word? Picture framework. Network, whatever it is, in the city now. I think it's absolutely an integral part of that, and makes a real difference. I think we were talking the other day, weren't we, about now got discharge to assess rather than assess to discharge, which makes a massive difference in terms of being able to get people out of hospital as soon as possible and into a place where we can really look at what their health and care needs are, and then hopefully, and in many cases, going back to their home and with adaptations, etc., or if it is appropriate, knowing exactly what the appropriate accommodation is going in. I think it is important to say as well that this is the partnership working with Southern NHS is really important, not only financially, because that means that it spreads the cost between the organisations, but also in terms of their ability. Now they have the running of our unit at Harry Sutcliffe House, that they can therefore instantly access some of those NHS services that we were unable to do when it was a council-run unit. But as has been alluded before, it's a jointly funded unit, so we are working together on that consistently. So I think it's a really welcome report. As Andy said, the winter planning situation is there, but we've had a care home failure in the last couple of weeks, which has meant that Shearwater. But as colleagues will know, that is what the top floor Shearwater is there for. It is there to enable us to have that ability to provide beds when there is provider failure, and I really thank the team. So as we haven't got a report on that, I'd really like to thank the team for the incredibly hard work they've done to make sure that people have been transferred, not just to that, to Shearwater, but also to other care homes in the city, to enable people to be kept safe and well right around that. And it's sometimes we don't get very much notice about this at all, and the fact that people were moved so swiftly has been incredibly welcome, and really have my great thanks for that. So thanks so much for the report. I really draw the attention to the fact that this entire system was set up very quickly during the pandemic, but it's really come on to be something that is now embedded. There we go, embedded into our system within Portsmouth now, and that it is going to be something that we need in the future. And watch this space for what the name's going to be. Just as a hint, it will be something to do with Sherlock Holmes, but that will have discussion with the staff, and they will come up with that. Oh, and also just to say, as the reports by Simon Nightingale, and that I cannot say enough, him and his team working from. He's based at St Mary's, but working with QA, working with all the providers, and working obviously with the discharge to assess units. They do a magnificent job, and we are in a much better state than very many other places around the country in terms of moving our people and getting them into a place where they're going to be properly assessed, so that they can get the care and support they need. So yeah, really great thanks to him and his team, and thanks so much for the report. Very happy to note. And that concludes the meeting, ladies and gentlemen. So thank you very much.